And coming back to this medicine information or general Ayurveda information directly going to the public, as Ayurveda community members, Ayurveda is getting globalized. The Ministry of Ayush is, every day they are signing memorandum of understanding with one or the other countries. WHO is also involved now with, a lot of Ayurveda getting pushed all around the world. So when things are opening up, if we keep our medicines, ingredients, even our approach, all those things open out in the public, overall it serves the purpose of maintaining transparency, and it gives a good positive vibe or the good positive stance for Ayurveda. So we should be encouraging more and more knowledge coming out and people knowing more and more about us.
Definitely, we should keep the things open, and then only it will be good, and which gives very clearly. See, one of the bad name which is being tagged to Ayurveda is that they'll keep everything information as closed circuits. They'll keep this information closed circuit, and even the previous good old practice is that they never used to tell what is there in the medicine. Just because that they'll say, if we say what is there present in the medicine may not work. That was the thing which has been told earlier many times in folklore practices. So we need to avoid all these things. Let the things should be open and very clear. What are the content present in that? But let me add another point here. When a yoga or a combination which is been described or explained, which contains so many drugs in that, for a trained person and an Ayurvedic doctor or as a young doctor, he himself will find difficulty to remember all the ingredients present in a yoga. Then how can a layman suddenly just comes and read once and remember everything? Either it is in the Sanskrit format or it is in the botanical name format or something like that. It will not be easy for them to just do it. Only they can do is that for a similar condition, if I am taking this one, you try this one for that can be given to another fellow. That is the only thing what we have come across. Otherwise, if you don't want to do that one and mask that combination to be specific to this patient, then they say it is a customized product for you. You should not be handing over, or you should not be trying on any other persons. It should not be given. It is peculiarly designed for your body nature and your body constitution. So if you say these things and give it, then they won't issue to anybody else. They will only use for themselves. That is the way you can block it.
Yeah, and in the allopathic, modern medicine, Western medicines, they also give all the information like what to do if it's overdose, consult your doctor, or do the basic things and do this. And also one important thing that they cover, medicine information out in the public is the drug-to-drug interaction. So these medicines should not be taken with that particular medicine and all. If some website, we also publish all those information in ayurmedinfo.com. So if the patient knows all those things, at least he will be aware of. A doctor during his busy practice, in the matter of 15-20 minutes, he may not be able to explain everything. So it will be kind of a ready reckoner for both the doctors and patient that the medicine information is out there, and it will help both the doctor and patients together, like you said, sir.
Definitely, it not only help them, because many times we might have conveyed many things to the patient, but may not be 100% conveying in a short duration. Then if something is there on the web or something on the internet, the patient, if you are very friendly with technique and this techno savvy, then he can read and study all these things by himself and make convincing that. Then if any doubts are there, he can come back to doctor saying that, this is what I had developed a doubt after reading these things. Can you clarify? Then it is our duty to clarify those doubts. Only when you clarify those things, then only if they consume it accordingly, and then the results are there, then definitely they will feel very good, and they'll become the promoters of Ayurveda for future, and also they are the advertisers for you. So it should be it should not block those type of things. If they are posing question, let them pose. I am here to answer. If you have the tendency, then nothing will happen, and it will be always in a positive direction. The things will move.